first of all, my name is Cheryl Scott. I'm one of the nursing faculty at Wisconsin Lutheran College. And so I have the privilege and opportunity to introduce two of our senior nursing students. And some of you may have already seen them downstairs at the poster presentation. But so Haley Moldenhauer and Jamie Shine, again, are two senior nursing students, both of whom had the opportunity with their class last year, last May, to travel to Zambia, Africa, and that's part of their global health clinical experience. That at the end of the junior year, the class travels to Zambia for a little over 2-week experience. So a little bit about each of them. Haley is a senior nursing student, as I said. She's going to graduate in May with her BSN. And her hope is to be able to work in the ICU setting once becoming an RN. At WLC, she's been involved in cheerleading for football and also our Student Nurse Association. And so she's looking forward to graduating in May and seeing what God has in store for her future. Jamie is also, again, a senior nursing student, and she also is excited to find out what God's plans for her are. She hopes to work with the pediatric population at some point in her career. And Jamie also has been involved in a number of different activities at WLC, also in cheerleading and the Student Nurse Association. So please welcome Jamie and Haley and their presentation.
Thank you, Professor Scott, for the introduction. So we'll be talking about our experiences while we were in Zambia, which was last May, and it's hard to believe that it's almost been a year since we have gone there. So we'll just give a brief summary of our trip and what we've learned and how this will affect our nursing practice here in the United States. So we left about last May from Milwaukee, and we took a coach bus all the way to Chicago. And it was quite the journey to actually make it to Zambia in itself.
So on May 17th, we all gathered around that coach bus we saw in front of WLC's parking lot. And then we, after frantically running around, making sure we had everybody and everything that we needed, we set out to the O'Hare Airport in Chicago. Then we flew on British Airways to the London Heathrow Airport. And after a long 10-hour layover in the airport, we finally got to fly to Africa. But instead of landing right in Lusaka, we actually had to go past Zambia and landed in Johannesburg, South Africa, because it didn't have a direct flight to Zambia. So that was just kind of a bummer. We were watching our travel plans, and we actually passed our country, and then we had to take another 2-hour plane ride back up into the country. So after about 20 hours or so of flying in the air, even more with just all of our layovers and everything, we landed in Lusaka, Zambia. So this just kind of shows our journey and how far we exactly had to fly.
So this is where Zambia is located. It's the highlighted country. So it's in like the middle southern region of Africa, and then it's right next to Malawi, where the WELSNA also has missions. And so here are some different facts about Zambia. The capital city is Lusaka, which is where we spent most of the time while we were there. And it's a fairly large and bustling city. I was kind of surprised to see how many cars there were, and they were fairly tall buildings, which was a little bit different than what I expected it to be. So when we left the mornings, we had to make sure we left early enough, otherwise we would be in traffic for a good couple hours if we didn't get going at a good time, which was very surprising for Africa. You wouldn't think that they have all these cars, but I think it's Japanese companies have actually donated a lot of cars, so most of the cars that we would see were Japanese. Their official language is English because before Zambia became an independent country about 50 years ago, they were a British colony, so that's why they mostly would speak English. When we were in the city, if we went to the store or in the hospital, the people would be able to converse with us. However, some of the people still didn't have that great of English, so sometimes we needed a translator at certain clinical sites. But their native languages are Tonga, which is more in the city, and then, Tonga is out in the rural areas, and then Nyanja is more in the city. Their money is called kwacha, and about 6.6 kwacha equals $1. So our money goes a lot further over there than it would here. When we went, it was their winter time. However, their winter is a lot nicer than our winters here. It was about 75, and it probably got even up to 80 some of the days that we were there in the hot sun. So even though it was winter, we still had to make sure that we had sunscreen on and protect ourselves, because the sun did get pretty warm, and some people had to almost got overheated being out in the sun too much. So we just had to be careful that way. But it did get pretty cool that night, so we had to make sure that we had pants and sweatshirts, because it got down to at least 50, 40s, which was a little surprising, but it is their winter, so. And then the official link, like Zambia is officially like a Christian country. So as we would drive through, we would see a lot of different churches and missionaries, and even the WELS has their missionary and their seminary in Zambia. But when I was out in the rural area, I did get to see some patients who believed in witch doctors, and they had actually, they were diagnosed with HIV, but they didn't believe that they actually had an illness. Instead, they went to this witch doctor who told them that the healthcare professionals like caused this and cursed them, and that's why they don't actually have something wrong with them. So it's kind of interesting to see how we were there associated with the Christian congregation, but then there's also still a lot of people who are believing in these tribal languages and witch doctors. So that's kind of something that's hard for the healthcare professionals there, and teaching these people that they believe their whole life about witch doctors and different things like that, and telling them to kind of go against their beliefs and what they've learned. Because as me, I've been WELS my whole life, and if somebody just comes in from a different country and tells me everything I've believed my whole life is wrong, well, I don't know how willing I would believe them. Or depending on the way they talk to me, I might just be like very defensive and not want to listen to them. So that's just something that the healthcare professionals there kind of have to, they struggle with in teaching these people and being very sensitive of their beliefs while we were there.
So in order to go to Zambia, we had to do a lot of things to prepare for our 2.5 week long trip. Some of these things include vaccinations, so we all had to get a yellow fever vaccine, which was quite costly for a lot of us. We all got an anti-malarial prescription. Some of us had to get a hepatitis A vaccination series if they didn't have it before. And then lastly, some of us got a tetanus booster, which actually came handy for one of our students because she cut herself on a rusty nail, so she was really happy that she did that. We raised a lot of supplies to donate to the local people, things that we take for granted or might even throw away today after we don't really need them. Tote bags, toothbrushes, and pens. These types of things were super special to these people, and they were so thankful to receive these kinds of things. We all had to make sure we had updated passports, and we all got visas. Everybody in our class, there were 20 people. We were all divided into different groups to prepare an educational topic to various different people in Zambia. Some of these topics included oral hygiene, HIV teaching, and a few others. Our packing list had to include bug spray, especially to keep away from the mosquitoes that might cause malaria, sunscreen, like Haley said. In some of the more rural areas, they did not have running water or toilet paper or bathrooms or anything, so we needed to make sure we brought our own toilet paper, and then baby wipes, because when we were in a really rural area for 2 days, there wasn't running water, so we couldn't shower or anything, so baby wipes really came in handy. And then lastly, we made goals for our clinical experience, so things that we really wanted to accomplish while in Africa.
So each person individually made their goals before the trip on kind of what they wanted to get out of this experience, but all of us seem to have fairly similar goals on what we wanted to take away from this experience. Overall, we want to become more culturally competent and sensitive to the different beliefs of the people of Zambia, because most of our cultures from the United States living in Wisconsin is extremely different than what it's going to be like in Zambia. So we wanted to see how it compares to the United States, just in their healthcare system, but also in their way of life, because the way they conduct their day is very different. If you were in the CAM presentation when she was talking about Zambia time, that is definitely very true. When you go to the doctor, you don't say, I have an appointment at 8:15 and it'll be half an hour and then I'll leave. It's like, you come for the day and maybe you'll have to wait till 3 o'clock in the afternoon to finally get your appointment. So it was just very different. What we also really wanted to learn is how to efficiently and effectively use resources, because they do have limited amounts of supplies compared to what we have, where we have stockfuls of rooms with all the supplies, and if I drop something on the floor, well, I can't use that anymore, so that's going in the trash. But unfortunately, they don't have the luxury of even having the things that we would throw away. So there's just wanted to learn how we could come back to the United States and be more conscious of the things that we're using. And then also have a positive impact on the people of Zambia, because throughout our clinicals we did get to meet a lot of people, and so we wanted to conduct ourselves in a way that we could show our faith by what we're doing, not necessarily sharing verbally all of our beliefs, but how we conduct ourselves, which is important back in the United States too, and letting your light shine through your faith by what you do and how you act as a nurse.
So once we landed in Lusaka, we got all our belongings from the airport, and then we all climbed aboard a bus and drove to where we were going to be staying for the next 2 weeks. And where we stayed was the Lutheran Seminary. This is where the people who are studying to be pastors and their families all stayed in little houses, like in the picture on the bottom left. So they all kind of stayed there, and then the men would get up in the morning and go to class and learn to be a pastor. So on this Lutheran Seminary grounds, they had 2 guest houses actually, and one of them is pictured in the picture on the right. These guest houses were just really simple. They had a few rooms with beds for us to stay in, and they actually did have a couple bathrooms that had running water and electricity. So these were just like really simple, exactly what we needed to stay there, and also we had a cook there that prepared all of our meals at nighttime, so it was just really nice to kind of gather around and share all of our stories at the end of the day from all of our different clinical experiences. And here's a picture of the sign out front of the seminary grounds. Since all the families kind of stayed in this area, there were a lot of children that we got to play with and interact with at the end of our day. They all loved hanging out with us, and in the top left-hand picture, I think we all just got done playing a big soccer game with them. But in addition to playing soccer or football, they showed us like different dancing games and just like played and ran around. They loved it when we took pictures of them and always wanted to steal our cameras. So this is just a fun thing for us to do. And here is a video, if it'll play, of them singing.
May not be fast enough on the computer. Praise you, Lord. So we ate a lot of food while we were there. We did not go hungry, to say the least. So the cook that she was talking about at the Lutheran Seminary, her name was Mrs. Narenda, and she prepared a variety of different types of food for us each and every night. So we didn't really have the same meal every single day. However, the white stuff on the bottom is called enchima, and it's like kind of looks like it'd be mashed potatoes, but it's not. It's like a harder and kind of stickier substance. And what you do is you like break off a little piece of it, roll it up in the ball in your hand, and then you'd use that to pick up other food on your plate. Because they don't really use utensils, while we were there, they offered utensils to us, so we didn't have to necessarily eat with our hands, but traditionally they don't really use utensils. And then on the top is some cabbage, and that was pretty much a staple at every meal along with the nshima. And then there would be some source of protein. Usually it would be beans or a small piece of chicken, depending on where we were. So some days at our clinical sites they would have food, and it would pretty much be like this. Or we also had peanut butter and jelly sandwiches that was at the Lutheran Seminary, so we could pack a lunch and eat snacks throughout the day too. But we definitely got to try traditional foods, and the cook at the seminary tried to make kind of more American meals too, so we didn't seem too far from our normal diet.
There are a few things that we mainly did while we were there. This 2 weeks in Africa was by no means a vacation. Even though we had a lot of fun and had a lot of great experiences, we were pretty much out in the community, working hard to either educate the people there. We educated the seminary wives on different topics. We went to different schools in the area, educated them about certain things, and then we also went to a Mwembeji clinic. This is the really rural area of Africa that we stayed in that had no electricity, no running water, needed an interpreter because no one there really spoke English. So just doing a lot of education to these people. We hosted a lot of blood pressure screenings in the community and on the seminary grounds. And then lastly, we did a lot of observations in the different clinics and hospitals, and the home health aides took us around to their sort of missions to help us, to let us observe what they do there. So a lot of learning experiences for us.
So how our days would typically go is that we would each be assigned to go to a certain clinical location, and then we would all go to our various locations during the day, usually come back around 3, 4 o'clock in the afternoon, and then we would have like a post-conference. So we would get to hear the different experiences that other students had, because we didn't necessarily get to make it to each and every single clinical site because we were only there for 2 weeks, and it's a lot of different things to try to get into that time. So it was really cool to hear what the other students were doing. And one of the things that we did is go to the schools and provide different education topics. For the most part, the kids spoke very good English, and the upper grades, it was just a little harder for the younger children who didn't have as much practice in learning English, because at home, their parents might not know how to speak English, so they're not going to be hearing it at home until they get to school and start learning it. But it was really cool, and I know that I didn't get to go to this clinical site, but I know the other students who did really had an awesome time in working with these children and seeing how different their schools are. Because I think the next picture, you can see kind of what the classroom looks like. It's a fairly small room with a lot of desks, and they're all sitting nice and close together. And they too have their pictures up on the wall, and they love to have their pictures being taken. And it was also really cool that we got to hand out some of the toothbrushes that we, as students, raised. I think we raised like over 300 toothbrushes as a group. So we got to hand them out while we were at the schools. And the kids were very appreciative of the toothbrushes because many of them didn't have them at home already. So it was something that they were looking forward to taking home and using and showing the rest of their family what they got. And we also provided education to the seminary wives on the seminary grounds. And the seminary wives didn't speak very good English either, so when we were there, we also needed the interpreter to just kind of clarify some of the topics and make sure that they were thoroughly understanding, because we did talk about HIV and pregnancy, so those are a little bit more complex topics that it was really important that the interpreter was there to explain everything and answer any questions that they might have. So it was a good experience on educating these women about these topics, because we stressed on having only one partner, but these women, they're pastors' wives, and soon they will be leaving the Lutheran Seminary and maybe going to Malawi or a different part of Zambia. So they will be educating the people in their congregation and making sure to encourage them to only be with your husband. And if someone already has HIV, and practicing safe sex, like using condoms, and different techniques like that, because they're going to be leaders of their congregation, and it's important that they are aware of these things and they know what to tell their people that they're going to be working with. And then also like the fire safety and the water safety, because they're the ones who are at home and cooking and making the meals, so that they know how to live in a good environment. And they might seem like simple things that everybody should just know, but in Zambia, some of the environment that they're living in is not necessarily the safest, and you can't assume that people know something. You just want to provide a good basis of education on a variety of topics, so then they can teach other people about it too.
So here's just a picture of a few of us before we went on our first clinical day. And my first clinical day was Ann Haley's, was at a clinic called Bite Here. And what this is, it's a outpatient and inpatient clinic hospital, mainly for pediatric patients. In their outpatient setting, they typically see things such as hydrocephalus and clubfoot. And there'll be like certain days of the week, like say Mondays and Wednesdays, that'll be their neuro day. So all these moms from all over will take their babies with hydrocephalus or other things to the doctor, and the doctor will evaluate them and see if they need a shunt placed or if they need a revision. And then maybe Tuesdays and Thursdays will be their orthopedic day. And then like if your child has other issues, they can come to the outpatient clinic as well. And if they need further treatment or any procedures done, then they can come to the hospital and stay in their inpatient unit, which looks like this. And you see that since it is for pediatrics, they have the walls painted all colorful, so every wall is decorated like this, and they make sure they have the mosquito nets put up to protect them from the mosquitoes. And as you can see, like something different from the United States is there's not really a whole lot of privacy here. It's just like a bunch of beds in a big open space. Also, if like somebody had like a disease, there really isn't any way to isolate them either, but they really make sure that they keep the windows open at all times to kind of like have the fresh air blowing. So this just shows you like how they're making the most of their resources. Here's a mother and her child at the hospital. Another little boy who's there, and they actually have a really nice physical therapy unit, which is right here. One day that I went, I saw a kid who had cerebral palsy being worked with some of the therapists there. Also on the Bite Here campus, there's a small little area for adult patients who, when I was there, I think somebody had a knee replacement, or just the adult patients can go there for various different things, and they know that they have to pay for their procedures out of pocket to kind of help fund Bite Here, and they're so, like, if they can afford it, they're so willing to do it because they know it's going for a good cause. Because for all the pediatric patients that come there, Bite Here is free. They also get lots of donors from all around the world to donate to them to help this cause. Here's one of the nurses wheeling around his medication chart, or his medications to give to the different patients. And on one of the days, a lot of us had the opportunity to watch a procedure happen. So here's me and one of my classmates all dressed up in our surgical scrubs. And the procedure we watched was on a hydrocephalus child. They weren't putting in a shunt or anything, but they were just kind of exploring his brain to see what was all going on. And an interesting fact about Zambia is the power goes out a lot. So as they had like the scope in the middle of this child's brain, the power went off a couple of times. So like the doctors just have to be really still, not to move anything until they just have to wait probably like 30 seconds before the power comes back on. They can actually see what they're doing on the monitors and everything. So that just makes you really appreciate all the like backup generators we have here in our hospitals, and the surgeons here don't have to ever worry about the power going out in the middle of a vital procedure.
So another one of the locations that we went to is called Kalinga Linga, Our Lady's Hospice. And usually there's a clinic portion and a hospice portion, but while we were there, they were doing construction on the hospice area, so there weren't any patients currently. So when I was there, I was mostly working with a clinical officer who's kind of similar to like a nurse practitioner, and they usually go to school for about 3 years. And so we saw a lot of HIV patients, and they were just coming in to get their antiretroviral therapies. So the doctor, or the clinical officer, had like a sheet, and he would ask them a bunch of questions on how their symptoms were doing, if they were taking their medications regularly, if they had any sickness, because then we'd kind of see about what stage of HIV they were in, and if they have progressed to AIDS, and what certain measures may have needed to be taken. We also had a couple patients who weren't coming in regularly, and they had missed a couple doses of their antiretroviral therapy, and unfortunately, if they miss a couple of months, they can't get their new prescription because they'll have to go back and get their CD4 and their viral load retested to just make sure and see how they are doing and if the medication dosage is going to be effective or not. So some of the people kind of got upset on, well, why can't I just get my medication right away? I did come in this time, but you have to think about that they've missed a couple of months, and sometimes these medications are funded by the government, so it's really important that the money is being used effectively, and for people who actually are going to stick to the regimen and use it, because otherwise there's probably other people who need it just as much as you do and will be following the, using the medications appropriately. I also got to see one of the patients came in with heart failure, and so he had ascites in his belly, and so the clinical officer took him back to a different room. He just had him lay on his side, he alcoholed off the stomach, and then he just stuck a needle in and hooked up the needle to like a Foley drainage bag, and it just drained out. I mean, definitely not sterile. He didn't wear gloves, no anesthetic to numb the area. So it was definitely an interesting procedure to see and watch. He actually told me that I could do it, which I did not do it because I do not have any formal training, and that is not within the nurse's role. But so it was very interesting to see how things are different there. Even though they did have gloves that he should have worn, he just decided not to for that experience. But here is the office that he was in, and so the patient would sit at the chair in front of his desk, and then he might ask him to come over and sit on the bed, depending on what they were there for. What was kind of interesting and very shocking compared to here is the patient who would come in to see the clinical officer, when they left, they would call in the name of the next person, and then they would come in. So there is no HIPAA followation and privacy rules, and very often other people from the clinic will just be walking in, and you don't know if the person in the room is undressing or something, and people are just barging in, so privacy is definitely not the way it is here. So it was kind of eye-opening to see, and the patients just acted like everything was normal, like it was no problem, people were just walking in and out. Well, you're having personal conversation with a healthcare worker that you might not want other people to know about if you're talking about HIV and your sexual history. You don't want some random person just walking in, but
oftentimes we saw a lot of the clinical officers on their cell phones while they're working with patients, or the pharmacist would be dealing with a patient, like they're telling them their medications that they need, and he's just on his cell phone, like whatever. So that's just something
the
totally
clinical
different.
officer I was with, he actually answered like a phone call. He wasn't just like texting or anything. He answered a phone call while the patient was there, and I just kind of sat there being like, should you really be on your phone? They came all the way here and you're sitting on your phone. But just how things are different there, and the technology. Pretty much everybody had a phone. A lot of people had Facebook. So technology has definitely advanced and made it to there, at least in the capital city of Osaka. So another clinical experience we had was blood pressure screenings. Like Jamie said before, we had some on the seminary grounds, and we also went out into different communities and did blood pressure screenings. So when we drove out, another student and I, we drove out about an hour outside of the city of Lusaka into a compound called Linda, and it was a rural area, and these people hardly ever leave their compound, so we definitely got to see a wide variety of people and actually age groups. I was kind of surprised. We saw like 70-year-olds and like younger children too, so people are still living longer there too. And so we saw over 40 people in this compound, and many of them didn't speak English, and they didn't even know what blood pressure was. When we advertised and were telling people, it was just, come get your BP tested, and they kind of knew that BP meant something about your health. They didn't really know like actually what it means, that there were numbers for it. So we tried to explain, these are the normal numbers, this is what your numbers were, and that if it was above the 120/80, we told them that they need to seek more care, and also we gave them tips on what they can do to help lower their blood pressure. Usually what you would say to normal, like in America, diet, exercise, different things like that, but in Zambia, a lot of these people are walking around every day, they're on cars, so we really had to emphasize their diet, because a lot of their foods to taste, they add salt, especially the enchima is very bland, so the salt helps to add some flavor to it, so that's kind of a hard thing to try to tell them to eliminate the salt, and also not consuming a lot of alcohol, because some of the people that came to our blood pressure screening actually had consumed alcohol prior to coming. So just making sure to emphasize like eating healthy and not drinking, and also not smoking, and different other benefits like that. It was kind of hard to recommend them to go to the doctor because there's no doctor in this community, and they don't have cars. It's going to be way too long of a walk. However, we still had to encourage them to seek more medical care, because I think someone's blood pressure was like 200 over 100 something, so they obviously needed to go to some sort of healthcare facility to get this further evaluated and see if they need some medications for it.
The home health visits for me was my most memorable experience. This man in the picture, his name is Paul, and he works closely with the seminary. And he took myself and another student out into the Avondale village, it was called, and these women were members of the church, and they volunteered often to go out with Paul and do home visits to people who were sick in their community. And I had the opportunity to go to two people's homes. One man had HIV, and one woman had HIV and tuberculosis, which I did not find out until after being in this small room with her. So that was interesting because we didn't have any protection or anything. But so we went throughout this small village. There's little chickens running everywhere, and just these houses. Their houses were just small little brick buildings, probably smaller than the average bedroom. That would just have like a couch in it and maybe a few of their other belongings. So what we would do is we would all come into this house, sit down and ask them how they were doing, and then we would end with a devotion, and just to remind them that God is with them and He's caring for them. And the woman that we saw who had tuberculosis and HIV, it was just so touching because we gave her a gift of a tote bag and toothbrush and whatnot, and like she was so down in the dumps the whole day, but as soon as I gave that to her, like her face lit up and she was just so happy, and she's like, I'm gonna put my Bible in this. So it's just crazy how such a little gift, like something that we got for free, can make their whole day, and like they are so appreciative of whatever little care we give them.
Another place that we went to was called the Charleston Clinic. I was actually there 2 days, and one of the days I was there, I was in the pharmacy. And so they have pharmacists, and they go to a special school, and the patients all have a little booklet that has kind of like their health history, and it also has their prescriptions in it. So the doctor or clinical officer will write their prescription and how much they want it for. And it's kind of like, you know, you hear the joke about American doctors, how you can't read their handwriting. Well, the same thing is true also there. The pharmacist gave me the book, and she's like, well, what drug does they want? I was like, I can't read this at all. And it was written in English, but I had no idea what it was. But they've had some work and practice, and they've learned how to decipher their handwriting. So it was also kind of funny how we have the same problem here as they do there. But what's interesting about their medications, they would usually just have one drug for each type of thing. So like if the one type of antibiotic is what everybody would get for the same thing, where in America you have 30 different antibiotics. You might try this one and then this one and this one. It was just like, well, if we had a lot of amoxicillin, that's what they're all getting. Or if we had enough penicillin, that's what they would be getting. So just also the lack of resources on medications was very interesting to see on what they may do and what they had, and tried to get more. And then while I was also there, I was with a volunteer who was trained on education about HIV and also HIV testing. So I started the process of, we were at the front desk, and a patient who was about 7 years old came in with their mom, and they came in to be tested for HIV. So we went into a different room, and we educated the little boy on what HIV was. So she used the story of there's good and bad soldiers in your body, and we wanted to test his blood to see if there were any bad soldiers, which was the HIV, and that if we're going to test to see if you have the good or the bad, but regardless of what the test shows, like you still can live your normal life, you just have to be a little careful in making sure you don't share toothbrushes or play with razors or other sharp things around your friends, because you don't want them to be getting your blood with the bad soldiers in it. So, and as the mother was there, she was just kind of intently listening as the volunteer explained all this to them. So then we took a sample, and then we went into another room, and they tested the blood. And so it had to wait for about 5 minutes, and they did 2 separate tests just to confirm that what the result was. And it did come back that the result was positive. So we had to go back and tell the mom and the son that he is HIV positive. And while the volunteer was telling the mom, she just kind of sat there and was listening, and like, I almost like wanted to cry. I was so sad for this poor child who had no control over this happening in their life. But HIV and AIDS is just such a common thing there that it really, I don't want to say it wasn't a big deal, but she didn't show as much emotion as I would have anticipated. Then that also might be part of their culture in not showing emotion during stressful times like this. So it's definitely a very eye-opening experience to see such a young child be diagnosed with something where less than 1% of the U.S. population has. So very interesting experiences, to say the least.
This is just a wheelchair we saw on the Charleston Clinic, how they kind of shift a lawn chair and put some wheels on it. So they just definitely make use of all their resources there. This is something new that they're building at this clinic. They really wanted these new stalls or rooms, small rooms, to be kind of a birthing center for their new moms, and it would also be used for other things as well. Here's a bathroom that I used at Charleston. As you can see, it is very unsanitary. I don't think any of the toilets flushed, and those sinks look very questionable. Another thing we did in Zambia was go on windshield surveys. So Dr. Carey would take us into the community on little walks just to kind of see how life is like in the villages. And this scene here was on a few men were on the side of the road selling these dried up fish on the bottom left-hand corner and these dried bugs on the right-hand corner. And we thought it would be funny to buy some of these bugs and give to our cook for her to put out at dinner time and not tell the rest of our classmates, so they would think she was seriously trying to serve us bugs. So we did it, and we gave it to our cook, but somehow it never made it to the dinner table, so we're not sure if she thought it was like a gift for her or what. So we never really got to experience this prank and see how it would have turned out. There's beautiful flowers everywhere in Zambia. Just walls and walls and bushes of such pretty colorful flowers everywhere. You often see children walking to school, and they always look super nice in their uniforms. And then there's these little market stands everywhere along the sides of the road where women are selling chitanis, which are like the skirts that they kind of wrap around themselves, or fresh fruit and vegetables. Here's an interesting scene. We often saw people selling these concrete pillars that they made. We're not 100% sure what they would buy these pillars for, but that was just something different from the United States. Again, more of these markets.
So another one of our clinical experience was we took a weekend trip to the bush, that's what they call it, which is the rural area, and we were at the Wambiji Clinic, which is part of the Central African Medical Mission. So we were there for about 2 days and got to follow different people and kind of see what their role was at this clinic, and we also got to provide education on different topics. So here is the back side of the building, and so you can see it's definitely been a little worn and it's not as fancy as some of our huge medical centers that we have in the Milwaukee area, and paved roads. So it's definitely very different visually from what we're used to here. And so here's kind of the outside of the clinic. When we first got there, the first day, everybody was gathered at the front entrance, and it was a large crowd of people who were there, many women with their children, and the leader would start out the day with a small devotion and just kind of remind everyone about God and how we should trust in Him and believe in Him, and that He's there for us in any struggles. And that's kind of like part of the outreach of the community, is helping them physically but also emotionally and spiritually by providing this care. And so each day we provided education on the different topics, and the gentleman on the right there, he was our translator. So we had to make sure we would give short blurbs and then he would translate back to us. However, when I first started my presentation with a couple other students, he was like, "What'd you say? I'm having trouble understanding your accent." So then I was kind of afraid to keep going, that they weren't, after that it was okay, but it was kind of like, are they going to be able to hear the rest of this whole 20-some minute presentation? But it ended up being okay. And it was really cool because there was a lot of participation among the crowd. They were willing to ask questions, and if we would ask them questions, they would provide feedback to us. So it was really cool to, they weren't just sitting there and listening, they were actually actively participating, and they were willing to learn and share with us what they were currently doing.
It was interesting to see how, like, one of our topics was oral hygiene again, and how I was trying to describe flossing to them, and they really did not understand that whole concept. So just trying to describe, like, oh, you take string and put it in between your teeth. So we're not exactly sure how well they understood that concept, but definitely a language barrier there.
And then at the front of when you first come in to the clinic, on the side, there's a little church there. So we got to walk in and kind of just take a look around, and there's a big cross at the front, and it was pretty plain, like, for the most part, but there were different pictures throughout the church, and it was just cute and simple. And also on the grounds, there were different houses where the healthcare workers would stay, and Dr. Carey, who's the head of the nursing program, that's where she had lived for 3 years while she was over there. So it was kind of cool to see the different homes of where the people were staying too.
Here is a well that some of our classmates are pumping water out of on the Wambiji grounds. When we were there, there was no running water or bathrooms or anything, but they are these things called chimboozis. So it's just like this little tiny brick area that you walk in, and there's this hole in the ground that you do your business and walk out. And these are kind of really interesting at night and kind of scary because you kind of had to watch out for all the big spiders, and somebody even had an interesting encounter with a bat in one of them. So at nighttime you really want to get in and get out. In Zambia, the buses break down a lot. So here's a photo of some of the men from the Wambiji clinic helping us, and then eventually our whole entire class tried to push start our van. After multiple attempts, it just was a failure, as you can see. So we're all exhausted. So then we had to pack up all of our stuff and head on about a 2-mile hike to our camp where we were going to be spending the night. But this just kind of gave us much needed exercise that we needed and allowed us to view God's beautiful creation as the sun was setting, and we got to just see the beauty of the land.
And we actually enjoyed the walk so much that our bus was fixed the next morning, that when we had to go to the clinic the next day, a lot of us walked again in the morning, even though we didn't have to. It was just such a nice walk to be able to see all the beautiful creatures. And on our walk, we actually saw a little boy who was wearing a Packers shirt, so we were all pretty excited to see that.
So when we got to our camp, it was just, again, another little bunkhouse that had a bunch of bunk beds, and we actually had to bring our own mosquito nets, so we had to kind of fasten them to cover us up, and brought our own sheets and everything to sleep on. So we were there for 2 nights. And the boys slept in the classroom next door, and they had an encounter with an owl in the middle of the night. So I guess just one of them woke up and shook his other classmates and said, "Wake up, there's a bat!" And they eventually got it out, and so I think we even saw a scorpion there too that we killed, so this is definitely more rural. So this is where we needed our baby wipes to kind of shower us down, so we were kind of glad to get back to Lusaka after it was a good experience, but we were happy to return back to the Lincoln Seminary grounds.
So we could shower and have hot water again. But another weekend trip that we got to take was go to Livingstone, which was about it took us a little bit longer of a drive because we took a couple of stops, but about 6 hours drive to the southern part of Zambia on the border of Zimbabwe. And so we got to go to Victoria Falls, which is one of the 7 natural wonders of the world. And this was probably one of the most awesome things that I'll ever see in my life because it was so beautiful. And I know a lot of people in our class were like, how could somebody not believe in God after seeing this awesome creation? It was so beautiful, and just the pictures do not do it justice of what it actually looks like when you're there. So this is like the front of the falls, and then this is kind of as the side, because we were able to walk on a path to go up to the top, and then this is where we got that picture with the rainbow. And then we actually got to walk across that metal bridge in front of the falls, and even though it's a fairly good distance, when you start getting closer to the bridge, we had to make sure we put all of our cameras, our money, and anything that we did not want to get wet in a plastic bag because we got completely soaked as you walked across the bridge, which you almost couldn't even look because so much water was coming at you. You kind of had to close your eyes and just hang on and not fall off, and our shoes were soaked, so we all kind of looked like a wet dog after it, but it was an awesome experience. And then after we walked across the bridge, we were able to walk on the other side, but the only way to get back is walk across the bridge again. So we got soaked again. And then you can actually take a hike down to the boiling point, and so that's where all of the water falls from the falls. So this is kind of what it looks like. I don't know if the video will work or not. Not really, but the water is just kind of like circling around. And we got pretty close and took some nice pictures, but we had to be careful because you do not want to fall in the water there. So it was really cool. And then throughout the park, there were some baboons that were just hanging out. So we had to make sure we didn't have any food and we didn't make any eye contact. And so if we took this picture, we had to be really sneaky because we did not want them to come and take our camera or get mad at us. But nobody got hurt. So that's good.
I know other students in the past have had encounters where they like grabbed their backpack and like threw them to the ground. So we were really careful about that.
We did not want that to happen to us. And as we were leaving the park, we just saw an elephant crossing the road. So traffic had stopped, like if here you would stop if you saw a deer or some other animal crossing the road. Well, over there they had the same thing but with elephants. So it was kind of funny to see all the cars stop, and of course all of us were like sticking our heads out of the window and trying to get a good shot. And Jamie got this really awesome shot of the elephant. So it was just kind of funny to see such a huge animal in its natural habitat. This wasn't on a safari, it was just out in the wild that we saw it, so that was cool. And then early the next morning, or early in the morning, we got up and we were able to go on a game drive for a safari. So we had two of these big trucks that we all piled in. I think it was like 6 o'clock we left, something like that. And so it was still pretty cool, and all the animals were awake and around in the park. So we got to see a bunch of different animals, and we saw a lot of impalas. So we got some good pictures. Oh, there we go. So that usually how they would travel is the male on the top with the horns, and then a lot of females would travel together. And so we saw quite a bit of them in the park, as well as a lot of giraffes. Got to see and get some really cool looking pictures of them while we were there. And unfortunately, we didn't get to see any like lions or big cats like that, because the park that we went to is the smallish national park in Zambia, which is actually 50 miles wide. So for the smallest park, that seems pretty large to what I would imagine. But so unfortunately, we didn't get to see any of the big cats or anything, but we saw a lot of cool animals, and we saw some big lizard things. I don't know.
Water monitors.
They're really scary looking.
Warthogs. Crocodiles, warthogs. They're like water buffalo, but we saw those in the distance.
Yeah. Monkeys. They were running all around.
So throughout our trip to Africa, we hosted. Each student had to do a few devotions at the end of the day, just to make sure we keep our focus centered around Christ. But on the last Sunday that we were there, we had an opportunity to visit the Lutheran church that's nearby the seminary, called Bethel Church. And this was such an awesome experience. We all wore our shetangis that we bought, because that's what they traditionally wear, and that's the shetangi from the Lutheran Church of Central Africa with their logo on it. Us again from the beautiful flower walls. Here's a photo of the inside of the church. As you can see, they kind of just sit on lawn chairs. It's plain walls, barely any decorations. So, but they don't need a lot. They know that like what's important is the Word of God, and everything else is just extra. Here's a photo of their hymnal that we used.
Which is this, if you can't really see it very well, it's the same service of the word that we use here on a Sunday morning. So it was kind of cool that when we came to church, it was in English, and I know the exact same songs, but not quite the exact same tune, but pretty close.
Here's a banner we took up there. And then at the end of the service, we had the opportunity to listen to a traveling choir that's makes up of members from different congregations in the area, and they just come together and sing just because they love singing for the Lord. And it was so beautiful. We just watched them sing so many different songs. And this one man in the front, he just held his baby the whole time on his arm while he kept singing and walking around, and that was pretty funny. But we'll see if you can, the video probably won't be great, but you can listen to one of their songs. Isn't that just beautiful? It makes you wish that we could sing like that over here and have that much passion and love in our songs.
What was pretty cool is that we went to church like the second to last day that we were there, so it was kind of cool to end the trip on that note and just keep reminding that no matter where we go in the world that there's people who believe in God and that the WELS Church is doing wonderful things all across the world, especially in Zambia. So it's really important that we continue to support the church and the missions like that. And then here's a picture of one of our nursing students with the guard, who sits at the front in like a little booth type of thing at the front of the Lutheran Seminary, and there's a little gate that he opens up to let different cars in, just because to ensure safety at the seminary. And there's a lot of children and the women there, so it's important that the people are safe. And I think a guard was there 24/7, always there, so making sure no one breaks in.
And it was time for us to head on home, so this is in one of the airports, getting ready to go back to the United States.
Landing back in Chicago. And just by the end of our trip, it was like, well, we know we're all going home, so we were just kind of ready to get back. But we really did have an awesome experience, and we learned so much more than we anticipated learning, and it was definitely an opportunity that we will never take back. And I know a lot of people are thinking about even going back someday and doing more work there, because this really made an impact on our lives, and not only in seeing what healthcare is like there, but being able to come back to the United States and thinking about the things that we learned and doing it and reflecting back on that when we work as nurses here. So it was definitely a very informative trip, but also it will impact us the rest of our lives as we continue to practice here in the United States.
I got a question. I was wondering, since you did have a couple of males with you, did they treat the male students any differently than the women?
Women or just people in general?
The nursing students.
The nurses.
Did they treat you differently since you were a male than they would the female nursing students? I was just curious.
No, I didn't. We didn't feel like we were
Okay.
being treated this way.
They had male nursing
Yeah.
students there too.
They
Like,
even had a couple male
nursing
nurses too.
Yeah.
It was more surprising that there were male nurses there too that we actually talked to, and they explained a lot about their practice. So that's what.
You know, that clinic, you said that there were adults that could come, but they had to pay for service. Did they give you any idea how much, like, a knee replacement would cost?
I really don't know those numbers. Not a lot of people got the chance to go visit in that clinic. I was just there very briefly and just kind of saw how they did things, and I just found out that they didn't get any help paying for their procedures, so I'm not 100% sure about how much that would cost.
I think they were fairly wealthy
Yeah.
if they were able to afford to come there. So.
There were 4 adults, I think, when I visited in that. Then there were a lot of other children, so